I'm Gina Tsarouchi. I'm a principal engineer in HR Wallingford's Flood and Water Management Group. My main areas of expertise are in early warning systems, land surface modeling, catchment hydrology, and over the last 10 years, I've been working internationally in projects that use Earth observation data sets for sustainable development around the world.
Super, Gina. So I'm Paul Monks. I'm the Chief Scientific Advisor at the Department of Business, Energy, Industrial Strategy. I'm also a professor at the University of Leicester in Earth Observation Science. So not an area that is totally unfamiliar with me. So thank you for joining me on the Good Development Conversations to kind of talk a little bit about and get insight into some of your research. But also today we're doing something slightly different in looking at the lessons that you've earned as part of doing this research, a kind of different way, I think, of bringing it to life. So what we've asked Gina to do is compile her lessons that have been able to think about the work and the projects that she's been doing, as she said, over the last 10 years or so. And in a way, what you've learned, or we keep putting L in front of it, don't we, or earned in this session. So let's start a little bit, Gina, with a little bit of a background on the project before we jump into the lessons earned.
The project we're going to talk about today is called DEMOS. It has developed a dengue fever forecasting system, which has been funded by the UK Space Agency's International Partnership Programme. The system uses Earth observation data sets to give early warnings for dengue fever outbreaks in Vietnam, Malaysia, and Sri Lanka.
Super. So dengue fever from space. On what drives? How do you detect? I mean, in a sense, I'm going to ask a question which I know is wrong. How do you detect dengue fever from space, or the factors that drive to making it predictable?
Sure. So to begin with, dengue fever is a mosquito-borne disease. It's today the fastest growing mosquito-borne disease in the world, actually. Yeah. It can be found in over 150 countries. And we have seen over the last 10, 20 years that it has been increasing substantially. It's mostly found in tropical and subtropical countries. And the costs of dengue fever are significant in terms of the burden it puts to health systems around the world. So what we do in this project is we are using satellite data to monitor hydrometeorological conditions on the ground. And these conditions affect the breeding of mosquitoes, the population, the biting rate. And so there is a link basically between hydrology, meteorology, and the outbreaks of dengue fever. So if we're able to track these conditions by using satellite data, we can develop statistical models of disease incidents and then use weather forecasts to predict future outbreaks up to 6 months in advance.
Wow, that's really, really interesting. I could talk about the actual project itself, but let's move to the lessons earned. How did you find that process of coming up with your lessons?
It was actually a very nice process, I thought, because it makes you think across not only this DEMOS project, but the entire career and the different projects that I've worked. It makes you reflect on what you have achieved, what you have learned, all the experiences you've had. And it's just been a very good way to, I think, summarize the lessons learned or earned throughout this 10-year period.
I think it's interesting. I mean, I must admit, I've done the exercise myself because I was asked to, and it is quite a reflective process, and it makes you think a little bit about you, the person, and the way that you interact with the research. And I've always argued that people do research. It's not a thing in itself. And in a way, I was particularly struck by your lesson number 2, which was cultural diversity brings a collective strength to research programs. So maybe you could tell me a little bit more about that one.
Sure. So in most of the projects that I've worked, we have large international teams working across different cultures. Particularly recently, I've been working a lot in Southeast Asia. cultures are different there, and it's always very interesting to try to learn from people who have been brought up in different cultures, and to try to find the best ways to communicate whilst being respectful of everyone. We are working in such an international environment today. A lot of brilliant minds working together, try to collaborate and focus on collective success. The problems that we have are global problems, and the only way, I think, to find solutions is by working together, bringing everyone together.
Yeah, I often find in science actually that actually that diversity of thought is actually really useful. So it's a diversity within the science, but actually I think in your project you're also saying that cultural diversity is an important axis as well, if you will.
It is, that's right. So diversity in science, I think, comes from, the fact that often you have people coming from different disciplines. So we have a lot of multidisciplinary projects working. So I'm coming from an engineering water resources background, but working a lot recently with health experts, Earth observation experts, government officials, policymakers, and all of us in some ways speak a different language, and there are a lot of barriers that we need to overcome to try to understand each other and to learn each other's language. But in the process of doing that, I think we end up with more innovation and more ideas, because you hear different perspectives that maybe you haven't thought about yourself or haven't come across in your professional career before, by just engaging with people that come from different disciplines. The culture thing is also interesting because, for example, working in particular in Southeast Asia, often cultures there are very hierarchical, and there is a lot of respect for people who are in very senior positions. And you have to learn to work with that and appreciate that. And in some cases, I've come across projects where this has been problematic because people from Western countries are not used to this very hierarchical way of working. But I think at the end of the day, just learning about it and trying to get used to these different ways, it enriches you as a person as well.
No, I think that's right. I think, I think one of the challenges that I know, as a person who's supervised many PhD students, is that, age or hierarchy is not something that's particularly useful in science. It's about the ideas wherever they come from and listening to them. So that those sort of structures can be a real barrier actually to good science rather than actually enabling it. But let's move on to some of your other lessons. Which would you say was the lesson that was the hardest one? Which one would you choose there?
That things will go wrong, and you have to get used to it, and I think try to make the most out of learning from all the mistakes you've done, and that sort of links up with the lesson of it's better to try and fail rather than not trying at all. In science in particular, the key, I think, to being successful is, yes, hard work, good ideas, luck, but also failure. And as long as you can learn from your past failures, keep trying, and eventually things will work out.
You probably learn more from your failures than actually. Failure is a really important part of science, and actually, often we undervalue it. And also always reporting the positive result leads to bias. So I think it's a really important part. So let's bring that to life. Things will go wrong. Could you choose an example from your work where or a link to it's better to try and fail than not to try at all? You kind of lesson one. What example from the dengue fever project would you choose, or from your scientific experience would you Scientific and engineering, by the way, I should always say, and engineering, shouldn't I?
Yeah. So I guess a broad example that applies to a lot of areas, I think, is that as scientists, you try to attract funding, you write proposals. A lot of the times these proposals are not successful, right? But you put a lot of effort in trying to get some funding, to put a team together to write something that you think is credible. Often this doesn't lead anywhere, but in the process of putting a proposal together and building a team, you've actually learned things, you've achieved things, and next time around you are in a better position to take the feedback that you've had maybe from the reviewers, the evaluators, and make a better submission for the next opportunity. So that's a general point. In terms of specific things that I've learned from the projects I've worked, I've had a couple of experiences where we've worked in developing countries in particular to try and develop a system, say a drought and flood forecasting system. And a lot of the work, the technical work, happens in the UK, is developed by UK scientists. And then we go in the country and we present them with something that we have developed. And you realize that actually the end users are either not interested, they're not engaged, it's not what they had in mind. So I think through this process that we've learned that it's really, really important to have this dialogue early on with your key beneficiaries, your end users, bring them in the team as soon as possible, and just keep this constant dialogue with them to make sure that they are engaged and that they feel this ownership for whatever system you're developing for them.
Yeah, I often found that one interesting fact is if you go to study drought, you can guarantee it will rain for the next 3 weeks. That's always one way you go. I want the specific set of atmospheric conditions that really occur here all the time, except when you study it, when they don't occur at all. Which I think is always quite an interesting one that But that was good. So I'm interested in your lesson 4, which there must be a real story behind you. Lesson 4 is, don't be scared to take on a challenge because it could be difficult. So what's the story behind that?
Well, it's the whole dengue fever forecasting project, actually. When we were awarded the funds to develop this system, it was the first time that anyone would try to develop such a system and make it actually operational, because a lot of research has happened over the last few years in terms of modeling dengue fever and potential forecast and things like that, but actually operationalizing the system and making it sustainable in a country was a big challenge from the beginning, and we knew that it would be difficult because of the political situation in Vietnam, the fact that these systems are quite expensive to actually develop, operate, maintain. They take up a lot of time in terms of getting stakeholders, building the capacity in the countries that need to operate them and understanding the benefits that they can get out of this forecasting system. So it needs almost a reset in terms of the way they manage their diseases like dengue fever. So we knew from the beginning that we're actually entering new territory here, and knowing that you only have 3 years to implement such a project and to make it sustainable was always going to be a challenge. So I think that's where this lesson is coming from.
It's a really interesting lesson in the sense of, I think often the easiest pathway is always the one that is less difficult, but you are bound to discover more. And I guess in this area, have a genuine impact on people's lives. At the end of the day, if you can reduce the impact of dengue fever on a population, that is a real societal benefit. in that sort of sense, and in a way that challenge that might be difficult, but what you achieve by getting that outcome is actually substantial.
And this type of system has the potential to be used worldwide, and as you say, reduce the cases around the world. So it was really important that we get it right in the first country that we went in to implement.
So what do you think the cultural barriers are? You've alluded to those a number of times as well, because I mean, simply when we sit here, we say, well, it's a health outcome. It's going to reduce health or disease burden. It's self-evident that this is a good thing to do. I mean, what's the cultural barrier to that? Is it the complexity and the cost, as you said, or is there anything else underlying that?
It's so there are a few different things here. I think, yes, the costs to develop these systems are important. There is also the time that is needed to accept and incorporate these new technologies. We have changes in political agendas. We often see in the countries that we work that there are changes at the top level of government, and this creates delays in terms of identifying the next focal point that can help with project engagement. Also, I think there's sometimes maybe a mismatch between what these new technologies, these Earth observation technologies, can provide and the need and the expectations of end users. And I think one of the most important reasons is perhaps this lack of understanding of the potential of these new technologies, and this has two sides. This lack of understanding. There's a lack of understanding among health agencies and health officials about what this environmental information can provide to them, in what form, but also there is a lack of understanding on the scientific community, I would say, in terms of what kind of information might be useful for the health sector and what's the best way to communicate this information.
I think that comes nicely to the next lesson, actually, in a way. It's an absolute segue to the next lesson. I was going to ask you to draw out a lesson or lessons that resonated in your time of working on the project with your international partners. But actually, your lesson 5, which you're kind of getting to, is the future of research is interdisciplinary, because you were exactly saying that, as an EO scientist, I can tell you exactly how to get, water moisture from space and deliver a product, but actually getting that to a health practitioner so they can make an intervention and understanding and working in an interdisciplinary way with it, for example, a health practitioner, as you were talking about there, is important. So that I guess is your lesson of the future of the research is interdisciplinary. So what's your reflection on that?
I think it's great that we are able to build these interdisciplinary teams now and have these conversations. It can be challenging, and it has been challenging throughout this project. It's probably one of the main challenges to try to communicate, the benefits of these systems and of forecasts and of uncertainty to policymakers, and to convince them, about things like you can still get value out of this system, even if sometimes it is wrong. Over a long period of time, it will help you. I think often policymakers and health officials don't want to hear about that. I remember at the beginning, early on in the conversations we had with them, they said they would only use such a system if it is 99% accurate. And of course, the science is not there for something like that. But we've seen that over the last 4 years, whilst we've been engaging with them and explaining and trying to train them in using the system, and the benefits that it has, but also the drawbacks, we've seen that a change in the way they are approaching things, and in the way they can now understand that, yes, I can use a system even if it's not 99% accurate. It takes time to build this trust, and it takes time for both sides, I think, to find the right language to communicate these messages.
Yeah, I think it's interesting, isn't it? Because if you're a doctor, you say, I'm not going to inject a drug in you unless I'm absolutely sure it's going to not kill you. You know, whereas actually this is a public health intervention has a different metric of success, I think, around that. But actually finding that common language, finding the common language and common understanding, which is what you're really talking about. Is it? I mean, I was reading your project. You know, you've worked together with epidemiologists, Earth observation scientists, meteorologists, software developers, and policy. And that's a huge interdisciplinary gamut, really, to drive that sort of innovation, and I guess also working in a different language as well.
That's right. Yeah. So there are a lot of barriers. You know, all these different experts in some ways speak a different language in their field. And I think the innovation comes by bridging those gaps. That's what brings the new ideas on the table.
And I should note, of course, that actually this is an award-winning project, and you won all sorts of awards at the 2021 Digital Technology Leaders Award, I'm told. Where you won awards at the 2021 UK IT Industry Awards for Emerging Technology of the Year, Best Charity, IT Project of the Year, and User Engagement Project of the Year. So clearly, again, I think that reflects the number of different categories and different ways that you would that this project has had this kind of disciplinary spread.
That's right. Yes, we've been very fortunate to win all these awards. We've won some other awards from the Group of Earth Observations in Sustainable Development as well. Also some local awards in Vietnam and Malaysia. And it's really great to see the project being recognized. It's truly a unique project. It's, as far as we know, it's the first of its kind.
Wow.
And it's the potential that it has, I think, that, you know, keeps us motivated, and we want to keep doing this work, because in Vietnam and in Malaysia now we see that it's actually working, that, you know, it helps government officials to take this early action. It has transformed their dengue control system from a reactive one to a proactive one, and we are starting to see that it is helping save resources and save lives, reduce the number of dengue cases, and it's really great.
That's just, you know, it's so thrilling in some sense, isn't it? I guess we're getting to the end of the conversation now, and we've talked a lot about the lessons earned. If you had to boil down these to just one lesson, which would be the most important of the ones that you've given us?
I guess it's one that we didn't talk much about. I think, you know, being part of a dynamic and diverse team is such an important. It's a privilege, and it's at the heart of any great project. These big projects and innovations, they can't be delivered by a single person.
Yeah.
They are a result of team effort. We spoke earlier about the interdisciplinary nature of the research and all the advantages of mixing different cultures and different scientific fields, and this all comes together into the dynamic and diverse nature of a team, I think. You know, projects like Demos are products of team effort. It takes time, and that I think that's the most important lesson, I would say.
Absolutely. I mean, working in teams as a scientist or an engineer is one of the most important parts that we do, and I think you've kind of captured that today in what is a wonderfully and fascinating project that really has social and health outcomes, uses state-of-the-art technology, is award-winning, but most of all it's about people, interdisciplinarity, working internationally with partners, developing teams. It's been a kind of a wonderful it's wonderful to kind of talk to you and get an understanding of what is really a very, very exciting project. So congratulations on all your work. Thank you for talking to us today about your lessons and how it really is people that make difference in projects, as well as teams, as well as undoubtedly you're probably very modest yourself and the role that you've played in that. So Gina, thank you very much for talking to us on the Good Development Conversations. We've thoroughly enjoyed it. Thanks very much indeed.
Thank you very much, Paul.